Hello, I'm Susan Acott. I'm the Chief Executive at East Kent Hospitals Trust, and today we're talking about research. So I'd like to introduce some colleagues who know a lot more about research than I do. Jess.
So I'm Jess Evans, I'm the Director for Research and Innovation in East Kent, and I've got with us Angela.
My name's Angela Moon. I'm the team leader for the research at Kent and Canterbury.
And I'm Adam Fell. I'm one of the core surgical trainees at QEQM.
So I really wanted to have a more general conversation around research and how you do it and how you go about perhaps getting involved in some of the studies that you do. However, I don't think it's really possible to talk about research at the moment without talking about what you have been up to during COVID, and as we come through the first peak of this global pandemic, how you have got us involved, the Trust involved in some of the research possibilities. And of course, research is one of the ways out of this.
Yeah, so the government sort of put research front and centre when COVID erupted, and we had to switch and close down and hibernate over 170 studies and 2,500 patients so that we could then adopt and rapidly take up the urgent public health research from the NIHR, the central government. And of that, we've done observational studies, genetic studies, and I think the big ones that the teams have mainly been involved in, our research delivery teams, have been our interventional drug trials, which, because of the success in that, we're able to offer East Kent the widest options of possible treatments for COVID that are available. So in typical Angela style, when we called her up and I said, we need someone at the Harvey, we're short of people, we've got to recruit more people, just said, when do you want me to go? Do you want me to go this afternoon? I said, no, tomorrow will be fine. But recovery's been our big interventional study.
So Angela, how easy or difficult is it to get people to engage with research generally, but also in this particular situation, that this recovery trial that Jess just mentioned?
So for recovery, and since COVID, we've been able to engage a lot more people than we had up to this point, because everyone had heard about the recovery trial. It's a national trial, it's from the National Institute of Health Research, and we're looking at finding the best treatments for recovery from COVID positive patients. So as the amount of patients increased that were being admitted to the William Harvey and QEQM and Kent and Canterbury, it was very much something that everyone wanted to become involved with, because there's no set treatment for this disease that we don't know anything about really. And it would be helping us to contribute to the national information, if you like, about the best way of treatment.
I mean, the level of engagement's been amazing. It goes from nursing staff on the ward allowing access to patients when they're struggling and dealing with patients actively, to people that wouldn't previously have considered being investigators coming and seeking out and saying, we want to do research, we want to contribute, we're seeing these things, what can we do to help? And then the junior doctors, despite being redeployed, have then been on ITU and they've been actively involving people. Adam and some of the team there, I'll let him tell you about what they've been up to, but you know, they've got themselves published in the Lancet and been making big contributions.
So Adam, were you always interested in research, or was this part of your COVID opportunity?
I started out studying chemistry and did a bit of research in labs and wasn't really interested, and that's why I've come to medicine. And I really had a very clinical kind of path. But since COVID happened, as surgeons, we found ourselves with a bit of time on our hands and kind of thinking about the things in which COVID has impacted our patients. Because a lot of recommendations came from colleges to change our standard practice. So even though there was the recovery trial going on and we were encouraged to engage with that, there's been lots of other studies that have been started up again by a global surgery group in the NIHR, which looked at any patient that had a COVID infection, what their outcomes were if they had a surgical procedure. So that's the main research that we've contributed to. And
I think he's being modest, because I think actually the junior doctors, they actually led this and they've actually initiated it and did it themselves, just with a bit of oversight from consultants. We led them through the process, said you don't need to have R&I approval, but go to the audit department. They did all that, they know, they led it, we didn't do it.
In terms of this exposure that you've had that's really live and really current, has that made you alter perhaps how you would approach your career in the next period, or does it really just give you an additional depth to your practice?
The whole COVID experience has given just an extra depth to what I'm going to carry on forward in my career. The experience in ITU and being involved in management of very sick patients with this disease has kind of helped my clinical knowledge and ability. The added level of research and being engaged with the research team, finding how easy it is to engage with and how enthusiastic they are to help us, it is really encouraged me, because I've always had a bad experience of research in the past of not really having much support from people, but in the trust it's been extremely easy to get involved, extremely easy to get help. Everyone just wants to help us, and it's been fantastic.
And Jess and Angela, do you think that this therefore helps the research profile in East Kent generally, or the profile of research, because somehow it feels much more relevant and accessible to everybody?
I think so, and I hope so, and I think it's because on a national level research was put quite front and centre. I think also the team are now more known. We know people didn't have answers to COVID, and the only way to get answers with COVID is to research it. So therefore, the purple army of these guys going out and sort of recruiting patients, making themselves accessible, getting themselves known to other staff, actually has sort of opened the lines of communication from the transfusion blood service, where we're now getting convalescent plasma. We'll be able, one of only 2 sites in Kent, Surrey, Sussex, to do that, thanks to the hard work they've put in, but also thanks to the support of everybody in the trust. So I think it has put it more front and centre, and I think we will get more engagement.
And absolutely everybody can take part.
Yeah.
So we do have a study called Psychological Effects of COVID, which is actually on Staff Zone. And we've had another 50 people this week already that have taken part in that. All they need to do is go onto Staff Zone, because the psychological effects, I think, at the moment are not known. So it would be really helpful if people could play a small part in helping to take part in research in that way.
The joy of research is you're offering people state-of-the-art treatments that normally would cost an absolute arm and a leg, but we're able to offer that to our population by engaging in research. We also know that patients do better. If you're in research, in an active research institute, your outcomes are better. So we're offering them state-of-the-art treatment, we're giving them improved quality of care, and I just hope that the momentum from COVID in research just continues. We can just keep all those people who never before thought they could do it, have now seen they can do it, and we'll keep doing it.
The more we find out about this disease, the more, from my way of thinking, the more odd and bizarre it seems to be, particularly in the variable way it impacts people. It's really interesting from that point of view. It's a really interesting virus and a very interesting disease, because I've heard a number of people talk about how it's personally impacted them in ways that I didn't imagine.
Yeah, I think it is a unique virus. And that's what means you've got to examine so many different aspects of it. But the impact is significant on some people, on other people less so.
And when do you think we might start to hear about some of the outcomes from your trials? I know it's very, very early stage, but typically, what is the kind of life when you start to get information back that starts to tell you something?
Depends on the size of the trial we're engaged in. So small studies of small numbers, we can recruit more quickly and we get a quicker feedback. The recovery study has already started feeding back things like hydroxychloroquine doesn't work. There's no benefit, so we're withdrawing that. We're therefore, when one drug doesn't work, we continue to open up, or they continue to open up into different ones. So as soon as they have that information, they feed it down to the centres. So we are already getting feedback of things sort of saying, remove this drug, this one doesn't seem to be working, will have a benefit. This one does have potential, like, remdesivir, we're now reusing that in East Kent. So it's a constant evolving process. We are getting information back already.
I don't think I've ever worked in the health service at a time when people have been more open to learning, sharing, so clearly the Italian intensivists were very quick to share their experience, and then you could see when it came to London and everybody was on through their networks learning and trying to shape it. And it seemed to me that even a few days additional knowledge gave you an advantage in the way that this sort of rapidly impacted us. Yeah. It's interesting to hear that you're now it's so live that you're getting some information back in terms of your treatment. What does this sort of felt from you in terms of your practice end, Adam, in terms of that kind of almost instant feedback, which is really unusual for research?
Yeah, it is. The COVID surge study that we've contributed data from has already came back, as Ms. Evans said, it's been published in The Lancet, and their recommendations are, older males who have an infection. The advice is to delay an operation because their outcomes are worse, particularly from pulmonary complications. you know, those type of recommendations are important to manage our patients when we're admitting patients. There's going to be an analysis of cancer patients as well and how their treatment has been affected over the past kind of couple months as well. So we're waiting for that to come out. So we just need to keep on contributing to the vast kind of database of knowledge. And I think these big collaborative studies are really important to find out, especially in such a kind of hotbed, you know, rapidly evolving kind of pandemic.
Yeah, it's important with patient expectation, because I guess, well, probably at one point in time I thought we would in a peak and then we just go back to normal. There is no going back to normal for some time, is it? And particularly the way it impacts clinical practice at a really granular level. Well, thank you very much for your time. Really, really appreciate that. And I hope that as well as helping the patients around East Kent, this also gives a massive stepping stone for research in general across the Trust. And thank you very much for your time, and thank you very much for all that you've been doing in this extraordinary 3 months. It's been exceptional, so thank you.
Thanks very much.
Thank you.
Thanks.